Healthcare associated infections incur variable cost. Different pathogens have a different effect. For example, we're beginning to realise that these multi-drug resistant, carbapenem resistant enterobacteriaceae, like E. coli, they tend to cost between £15,000 and $20,000 per infection, and that's based upon hospitalisation, any procedures that are needed. For example, the cost of a day in your average hospital is about $1,500 roughly, and then you've got all of the drugs and other extra costs that add up. So where does C. diff compare in the sort of the league of bad actors? And I think C. diff is in the top 2 or 3. As I said, there's the carbapenem resistant pathogens. There's an organism called Acinetobacter that incurs costs anything from $10,000 to $40,000 per infection. C. difficile, again, there's a range. There always is a range, but it's around $10,000 to $15,000 per infection. That is what is currently estimated, but that is based upon cost of drugs, time in hospital, and then all of the other infection control and the other extra activities that are required to treat someone effectively with C. diff. So C. difficile is certainly in the top 3 or 4 expensive infections. As you know, 20 to 30% of patients with C. diff do have recurrent disease, and clearly those recurrent incidents add to the overall cost, and so the cost per infection for C. diff is, as I say, but if you want to look at the entire societal cost of C. diff, you need to factor in that 1 in 3, 1 in 4 patients will recur, and therefore that incident, which is usually a little bit more complex, so it's going to be the 15,000 plus. So if you take the 500,000 cases of C. diff in this country, the costs start to add up very, very quickly.